Hi, my name is Akash. I'm a fellow from the University of Washington, and it's my pleasure to talk to Dr. Steve Nissen from the Cleveland Clinic Foundation.
Thank you. Good to be with you.
Dr. Nissen, what sessions are you most excited about for ACC 2018?
Well, I just came from the main tent where the late-breaking trials are being presented, and the Odyssey outcome trials was presented. This is a long-awaited second big trial with PCSK9 inhibitors in patients, this time post-myocardial infarction. And it showed, like the Fourier trial, about a 15% reduction in major adverse cardiovascular events, which is a good result, and a nice trend on mortality, which was not seen in the previous Fourier trial. So that's very encouraging for getting more patients onto these drugs, which we think is the right thing to do.
Great. And then how do you think this is going to change clinical practice?
Well, it remains to be seen. Unfortunately, we live in an era when the pharmacy benefit managers rule the world. And so it's not so much what we think, it's what they think. And it's very unfortunate. I actually think it's a challenge for young people now entering the field that so much of the decision making is no longer in the hands of physicians, but in the hands of bean counters. And I'm hope that this next generation of physicians will push back on the use of that approach to selecting what patients to treat and get back to thinking about medicine as a science rather than the political and economic implications.
Great. Okay, and then I'll end by asking you what advice you would impart on other FITs.
Well, go into academic medicine. I've never regretted it. And if you do, pick one thing and get to be very, very good at it, and you're likely to be successful.
Okay. All right, thank you for the advice.